Healthcare's Turn to Extortion by Micah DeVell
and Tyler Richards. In the mid-1900s, American healthcare prices experienced a turn from affordable to extravagant, causing many Americans to need assistance.
The three major points to this argument are that corruption within the industry led prices to rise,
The introduction of insurance led the prices to rise,
and the fallout of those rising prices resulted in many people being taken advantage of and requiring assistance.
To start off, the corruption in the system that led to rising prices. Between the years 1900 and 1910, the population of doctors on American soil more than quintupled, going from a population of 8,000 to over 70,000 in around the course of 10 years. In that time, the quality of over-the-counter drugs also skyrocketed, becoming more swift and efficient at their jobs. The practice of surgery also swept the nation. It was a U.S. sensation. According to the PBS website, hospitals became, quote, modern scientific institutions, valuing antiseptics and cleanliness, unquote. They became squeaky clean centers of medical research and application. During that time also, the American Medical Association, or abbreviated AMA, became a powerful force as it reorganized into a national organization for both local and state associations. Previously, in the late 1800s, the American government had forced self-employed doctors to set a cap on their healthcare prices. This angered and even infuriated many such doctors, causing strife within the industry. Thus, in the early 1900s, doctors were allowed to have free rein over their prices, giving them the right to choose how much their services cost. It was because of this and the ensuing corruption, in which doctors sought to increase their revenue by as much as possible, that in the 1960s, the price of healthcare was mountainous. It was during that time that the population, especially the elderly, found themselves in need of healthcare, yet unable to afford it. It was also during that time that, due to the baby boom, there was a serious doctor shortage, causing prices to rise even more. Then, due to many factors including inflation, unexpectedly high Medicaid prices, which was a government attempt to pay for the health care and health insurance of the poor and homeless, and the increased use of medical technology, the prices again increased double the amount and caused the poor population to increase in many people's attempts to pay off the expensive medical bills. Finally, in the 1990s, the prices increased again at an extreme rate, double that of the rate of inflation. Thus, those who couldn't afford medical care increased by a tremendous amount yet again. We interviewed Dr. Maris Ramsey, a family physician for ChenMed, about the fraud and corruption that she saw within her industry, and here's what she said.
I have lived through multiple news events where fraud has been mentioned in the news. There have been doctors and hospitals and medical groups that have been sued by the government for many millions of dollars for their parts in corruption. So I guess the most common types of corruption in medicine that we see in the news have to do with providers providing procedures that are not necessary, prescribing medication that isn't necessary, giving injections of medication that aren't necessary. That's unfortunate. There are real victims to this. It's not just the financial aspects of it, but patients are victims.
On top of that, insurance also led to the increased prices. Insurance was developed and given government support in the 1910s, but it wasn't until 1932 that the first prepaid network, Blue Cross, came into existence. It was a connection of the various and sundry prepaid healthcare plans that had been designed by businesses as a way to give bonus benefits to their employees. The medical industry, however, feared that the Blue Cross network would open the gates for other third-party companies to force the doctors into limited prices once again. Thus, they came up with the plan known as Blue Shield, a network of their own insurance plans covering physician services to counteract the Blue Cross. Get it? During the years that followed, namely the years between 1940 and 1950, the active members of Blue Cross and Blue Shield increased from roughly 20 million to 142 million, more than 6 times the original number. Multiple attempts were made during this time and afterwards by the government to insure the poor and homeless population, such as Medicare and Medicaid. These two systems were developed as ways to give help, specifically healthcare and insurance, to the low-income, poor families of America, such as the elderly, pregnant, and physically disabled. These government actions, however, turned out to be far more expensive than they had originally anticipated, and this caused healthcare prices, along with insurance prices, to skyrocket. Many people were left relying on the aforementioned programs because they became unable to pay for their own healthcare. A simple way to explain the relationship between the healthcare prices and the insurance prices is this. As healthcare prices increase, the insurance prices increase in order to cover them and to perform their job. However, in order to keep from being capped and controlled, doctors then increase their own prices. In response to that, the insurance follows by increasing its prices in order to remain covering the healthcare bills. As such, the healthcare system increases its prices along with the insurance, causing a vicious cycle that keeps the prices of both escalating.
Those two problems combined caused the fallout that affected many people all throughout America. According to West Health and Gallup, an international analytics firm, one of the nation's largest polls recorded that 44% of Americans, almost half the country, struggled to pay for their healthcare. A large portion of this number was from the old population, the black population, and the Hispanic population. The same poll stated that 93% of Americans didn't believe that what they paid for was worth the cost. As you can see with these graphs, the money spent by America throughout the years has grown by a substantial rate, while life expectancy is doing worse than our peer countries, being Canada, France, Germany, Japan, Switzerland, and the UK. With prices so high and quality so low, many people were forced into bankruptcy. Through that poll, it can be concluded that, even with insurance, a large number of people still had to pay prices that were more than they could afford, and those who could pay the prices weren't given adequate treatment for the amount of money that they paid. Because of this, many people held off taking their prescribed drugs in order to save money. They would attempt to stretch out their usage of their drugs as long as possible to avoid having to pay the enormous amount that each drug cost. This resulted in a large amount of deaths and undertreated diseases. Many of these deaths are recorded, calculating to roughly 125,000 deaths each year from people who didn't take their drugs as prescribed. Then, as far as prices went, people were not only forced to pay the insurance, but also because the insurance didn't pay for the entirety of the healthcare bills, the patients also had to pay out-of-pocket hospital bills. Thus, people were forced to pay high prices on both sides, to the insurance companies and to the hospitals. This added to increased poverty levels even more, leading to the prices and poverty levels that we're faced with today. We asked James Tinner, the Administrative Director of Surgery for Nemours Children's Hospital, what he thought about our claims about health insurance leading to rising prices, and here's what he said.
So it does add cost. You're right. It adds because it adds a middleman. It adds a layer. It adds expense on my side to make sure I get paid. It adds their incentive to make a profit. It adds my having to react to their model of wanting to not pay me. Their interest in not paying me adds cost. And ultimately, everything is paid for by the patient, by you and me.
While the healthcare industry was still developing in its efficiency and strength, it began to fall to corruption. While at first doctors within the medical system during the early 1900s were just escaping from their previous struggles with price caps, by the 1950s, they began to increase their prices at rates that left many people in extreme poverty. During that same time, the industry of medical insurance also began to flourish, with both employers and the doctors themselves selling insurance policies to patients. These plans, however, bounced off each other and the healthcare companies, leading to even steeper prices. The victims of these raised prices have been numerous since the mid-1900s, many of which dying due to their attempts to save money. Thus, it can be concluded that in the mid-1900s, the prices of American healthcare turned from affordable to extravagant, forcing many to need help.